the Maria Holder Diabetes Center.
Even without symptoms, uncontrolled blood pressure can damage your organs.
In 2026, for podiatry, diabetic eye screening, and vascular services, the Maria Holder Diabetes Center is your #1 choice for the best diabetic services at the best price. If you are diabetic or pre-diabetic or would just like to get your numbers checked, diabetes doctors, nurses, a dietitian, and a range of health professionals are available to serve you. Just call 417-0305 for the Maria Holder Diabetes Center located in Warren St. Michael, saving your life and saving you money. Board members get 10% off.
A good April afternoon, Q family! And you know what time it is.
What time it is?
Time for 15 diabetic friendly minutes on 100.7 QFM. Compliments the Barbados Diabetes Foundation, the Barbados Diabetic Eye Screening Program, the Maria Holder Diabetes Center, and First Citizens Bank. They put you first. It's Peter Boyce here, greeting you on the 1st of April, known as April Fool's Day. Some people would say it's a day that celebrates me, and I ain't gonna argue with you, but I want to encourage you not to be an April Fool or any kind of fool, but if you are diabetic or pre-diabetic, making an appointment to visit the Maria Holder Diabetes Center, located in Warren St. Michael, right behind Eunice Gibson Polyclinic. You can get vascular screening done there.
But why would I want a vascular screening?
If you notice your feet has been swelling up recently, you can't get your foot in your shoe, and you feel you might have what Bajans call bad circulation, don't go by feelings, get it checked out. A vascular screening at the Maria Holder Diabetes Center will tell you exactly what the issue is. Also, there's eye screening for diabetic retinopathy, and there's even a dietitian, Victoria Cox, where you can make an appointment and get healthy advice on what you should be eating. Cause you know, sometimes we just be eating things and we just think they're good for we, and the next thing you know, it is be the opposite. Take for example, sea salt. You might be using sea salt instead of regular salt, and you might be thinking it's a healthier option. Well, take a listen to this. It's Medical Mythbusters!
You feeling so?
Somebody tell me.
That's what they say.
Oh, you see it on the internet?
But what really is the real truth, though?
This is Medical Mythbusters! The truth is here!
Wait, Alfonso, you cooking? Well, I know you could cook.
You think I can let a woman starve me out? I know my way around the kitchen.
I can go taste you hand. But wait, you putting very much salt in that food though? That ain't bad for your blood pressure.
Now you see, Mildred, this is not just normal salt. This is sea salt. Good natural salt from the sea. It's good for you.
You sure about that? Let me find out what Victoria Cox, dietitian from the Maria Holder Diabetes Center, got to say about it.
It's not uncommon to be asked if there is a benefit to using, sea salt or one of the other kind of what I call fancier salts, pink Himalayan salt or something, as compared to regular table salt for blood pressure. But the long and short of it is really no, there isn't a difference, or there isn't a benefit, I suppose. Sea salt and regular table salt are both going to contain a similar amount of sodium. So, the salt is sodium chloride, and it's the sodium itself, which is what we tend to be concerned with in terms of raising blood pressure levels and increasing the risk of hypertension when consumed in excess. So, sea salt may be promoted as a healthier option because it is considered less processed, or it contains a higher amount of trace minerals, so things like maybe magnesium or something like that. But, even those trace minerals that these sort of fancier types of salts may contain, they're not going to be in a high enough amount that really offer proper health benefits in any meaningful way. And again, they are still coming packaged with the sodium. That is what we want to limit. So this is not to say that we may not have preferences. Sea salt may be kind of a different texture, chunkier, flakier, and we may prefer one over the other in cooking. But certainly from an overall health and blood pressure point of view, the ultimate goal is less is still better, even with, the sea salt compared to table salt. Less is better as far as our blood pressure goes.
Thank you for that salty advice, Victoria. I am sure the people listening to QFM were listening carefully.
I can really go cut down on my salt for true.
As we move on to some more healthy advice with the compliments of First Citizens Bank, we are moving on to Dr. Diane Brathwaite. What are you talking about today, Dr. D?
Today, we're going to talk a little bit about diabetic nerve disease, but we're also going to follow that on with a nice celebratory story, and that's Tanya's story and her take on how she managed to get her blood sugars from the very high 20s all the way down to 4, 5s, and 6s, and how she's been able to come off of most of her medications. So let's just backtrack a little bit again, and this is an important topic because it's something that we see quite commonly, and diabetic neuropathy, which is diabetic nerve injury, can occur in as many as 50% of persons living with diabetes. It is generally said to be irreversible. However, if you catch it early through strict control of blood sugar and proper care, it is possible to relieve some of the symptoms of the diabetic nerve injury. So there are different types of diabetic neuropathy. So I'm going to just go through 4 types to make it a bit easier to understand. We have, first of all, the peripheral neuropathy, and that is a nerve injury that affects the smaller nerves at the end of the limb, so therefore in the feet and the hands, okay, or the legs and the arms, if you want to think of it that way. More commonly, people have sensation symptoms, so things like numbness, tingling, you may get pain. The pain sometimes is described as burning, other times it may be stabbing or aching in nature. And the symptoms of diabetic peripheral neuropathy generally tend to be worse at night, so people will find that the pain comes on at night time, or it may be noticeable in the day, but it gets worse at night. So that's diabetic peripheral neuropathy. Then we have something called a mononeuropathy. Mono means one, so it means that it's affecting one nerve at a time, or individual nerves at a time. And although it's affecting individual nerves at a time, it can affect several individual nerves at a time. So for example, this may be represented by damage to a single specific nerve, for example, in the face, in the trunk, or the leg, or the hand. So for an example of a mononeuropathy, it can actually be carpal tunnel if you're living with diabetes, or it can affect one of the nerves in the legs and cause something called a foot drop, where you have weakness in the foot and you can't lift it and clear off the ground easily. Then we have something called proximal neuropathy. This is much less common. However, if the blood sugars are very high, it can be quite a disabling form of neuropathy, where you have large nerves that supply the muscles of the legs and the hips being affected, and it can cause sudden severe pain and very profound weakness. So you may find that person may have difficulty, for example, getting out of a chair without pushing upon things, and it tends to come on relatively sudden, and that can improve with very good control, although improvement will take time and it will take the assistance usually of a physical therapist or something like that. And finally, we have something called autonomic neuropathy, and this infects the internal organs. So in other words, the nerves supplying the internal organs that control like bodily functions. So persons who have autonomic neuropathy may find that they may have challenges, for example, with their digestion or their bladder. They may have constipation, diarrhea, urinary retention, irregularity of the heart rate. They may get things like drops in the blood pressure when they're standing up, abnormalities of sweating, and these are just some of the examples as to how the autonomic nerves can be affected.
Thank you, Dr. Diane Brathwaite, for that interesting presentation on diabetic nerve disease. QFM people, listen out for part 2 next week as we go into our Q song of the day, and it's April Fool's Day, so it's an April Fool's song.
Some country and western coming through your radio that's gonna make you feel like you're a Q in the community.
This is Calling Ray with April Fool.
Compliments, the Maria Holder Diabetes Center and First Citizens Bank.
I'm just a fool for April.
The Maria Holder Diabetes Center.
There's nothing more to say. Long as I can remember, she's led my heart astray, and I'm an April Fool.
The Maria Holder Diabetes Center.
And Tanya, how are you doing today?
Good morning. I'm fine, thanks.
Thanks for agreeing to just say a few words to me. First of all, we have a drum roll.
I want to congratulate Tanya. Tanya has lost 40 pounds and she has moved from basically having diabetes, being on insulin, being on several tablets, just to metformin only because of PCOS. I gotta say, drum roll. And an A1C of 5.8% from, what was it? Unreadable or something mad like that, over 14%. And that was done over a course of, I would say this about 9 months or so. So I want you just to give us just a few words of advice. First of all, the journey, because I think it must be really hard having all of that as a younger person. You're younger than me, so I mean young because I'm still young, right? All right, but you're born. How old are you, Tanya? 42. Okay. So can you just give just a few words, I think, of advice maybe, and also maybe how to kind of roll through that kind of journey to this point where we are continuing to work towards your diabetes remission?
First, I had put my trust in God, and the first week I was diagnosed, I was like, this is crazy. So when I went to church that week, I went to the altar, and that same week they were talking about healing and stuff, and I went, and he said, by his stripes I will be healed. And I keep my faith, I keep working at my diet, I continue to take the medication, and I just I am healed, so I am just not taking this and I am just not taking that. I just focusing on my diet, my exercise, and that's how I have been for the last couple of months.
Okay, so I love that, because you know what, I always say we can be healed, but faith without work is dead, and that's scripture. So it just reminds us that we have to put in the effort as well.
Yeah, you just gotta stay focused on what your goal really is and keep your trust in God.
Okay, and so therefore we have focus, we have discipline, but I also want to put in the word plan, and that means having a plan for how you're going to journey through those changes in your lifestyle, in your diet, in your exercise, and figuring out how to be consistent. But I just want to congratulate you. I'm so proud of you. This is so amazing. But truthfully, you did the work.
Thank you.
If you are diabetic or pre-diabetic and listening to QFM right now, Q stands for Quality Health Services at lower prices, which is what you will find at the Maria Holder Diabetes Center located in Warren, St. Michael. If you are looking for diabetic eye screening, vascular screening, podiatry, or nutritional advice, call 243-3937 or 417-0305 and make an appointment today. Don't miss next week when we will be dealing with more diabetic issues. Same Q time, same Q station. Compliments the Barbados Diabetes Foundation, the Barbados Diabetic Eye Screening Program, the Maria Holder Diabetes Center, and First Citizens Bank.
Together, we can turn your dreams into reality, whether it's owning your first home, driving the car you've always dreamed of, or a little extra cash for life's special moments. We're here for you. At First Citizens Bank, we'll work alongside you to create a loan that's as unique as your goals. Let's take that first step together. Visit firstcitizensgroup.com or your nearest branch to find out more. First Citizens, we put you first.
If you or your loved one is impacted by diabetes and have questions, the Barbados Diabetes Foundation has the answers.
It's always easier to reverse diabetes, certainly control it properly and avoid complications if you at least know that you have it.
So it's just again to re-emphasize the importance of good diabetic care. And diabetic care involves really almost every part of the body. So it's your feet, your heart. But again, we're coming back to what our main focus is at this time is the eye care.
The Maria Holder Diabetes Center, located in Warren, St. Michael, is your source of diabetic care. You can reach them by calling 243-EYES, 243-3937 for more information.
1 in 3 adults with diabetes also has high blood pressure. Don't ignore it.
The Maria Holder Diabetes Center.